So we're back for yet another episode, and it's my great pleasure to introduce Rachel Henson, who is a menopause practitioner. She was a nurse before this, but went into the speciality of the menopause. So thank you, Rachel, for taking the time out. So maybe you could add a little bit more to my very sort of skimping introduction.
Yeah, well, I think you've said it all, really. Yeah, registered nurse. A long time, so 20 years now. I've been a registered nurse. So I've done everything under the sun, really. Predominantly practice nursing. Then I needed to leave nursing at one stage due to my severe menopausal symptoms, unfortunately. And that's how I ended up learning a little bit more about the menopause and all the issues that go along with it from a personal point of view. So I knew it initially from a nursing point of view, but and so you don't get much of that training. It's sort of for the older lady, sort of, yeah, when you're 50, these people will come and they'll have these symptoms, and then that's when we send them off. But it was not explained as much as it is now. So now we've got this massive influx of information, which is wonderful news.
Yeah. So how old was you when you started with the symptoms, or when you actually knew you were starting with the symptoms, you was aware of it?
Yeah, well, I wasn't aware of it initially. So my symptoms started when I was in my early 30s. So I was about 31. I wasn't aware at the time that was the issue. I went to the doctor. I was exhausted, various different symptoms, hot flushes, night sweats, absolutely exhausted. And they said, "Oh, you're a working mom. That's what it is." They checked my thyroid, which can cause the same thing. So it's always worth getting everything checked that can cause similar symptoms. I get everything else checked. No, there's nothing else going on. So they put it down to anxiety. So okay, yeah, that's fair enough. So I went away, carried on as you do, family life, working life. And then it was just the tiredness got so much. I needed to sleep after work before I picked the kids up, because it was just so draining. I couldn't concentrate, couldn't do anything. I found it a struggle. Went back again, said no, you nothing's going on, you're just a working mom. So okay, carried on again. This happened continuously for quite a long time, and then I started to get more symptoms. So bladder issues, got referred to various different bits with that. Then increasing intolerances. I've got a lot of intolerances. I'll get onto that in a bit. And then hair falling out, dry eyes, eczema, weight gain, and then PMS symptoms as well. So mental health issues started. Went back to the doc and they said, "Oh yeah, okay, so let's try some antidepressants." I declined that because I thought, no, that's not quite what's going on. I want to figure out what's going on for myself.
Yeah.
And then out of the blue, I couldn't carry on. I had a panic attack one day for no reason, middle of the night. Woke up, panic attack. What on earth is going on? Didn't realize what it was at that time. My heart was going so fast, and I thought, good grief, what's going on? So I ended up in A&E. Got checked out, and they said, yeah, it is a panic attack. I thought, where's that come from? Because it wasn't me. I was absolutely fine in myself at that stage. When I realized, so when we figured out what was going on with myself, I was like, okay, everything's coming to head. But before I got that diagnosis, I went back to the doc, and they again, antidepressants. I'm like, no, it's not that. So I started on the CBT, meditation, exercise, and then eventually I needed to leave work. I just couldn't do it. I couldn't leave the house. Couldn't stop crying. The anxiety was so bad. I couldn't go to work. As nursing is, as people know, it can be a very high stressful job anyway. So things that I used to be able to deal with, I just couldn't do anymore, and it wasn't safe for me to do it because my brain fog. I just couldn't figure out why it was happening. Noticing that my symptoms were more cyclical. With that, so intermittently with my periods, which were changing as well. So monitored, started to write down in a diary what was going on. Then I noticed it was a bit more of a cyclical change with absolutely everything. So little bits of PMS starting to get worse as well. Then, as I said, lost my nursing job after a little bit of a while. which again, it was heartbreaking. I was really confused, really angry. And yeah, I was like, why is this happening? It's not fair as such. I'm trying my hardest, and something wasn't right. Didn't know what was going on with it. And again, for my poor kids, obviously, they were only little at the time, and it's trying to be a normal mom with tons of energy is exhausting.
Yeah.
It really was. So once I'd left work, luckily my husband's got his own business, so I ended up working with him just to feel that little bit of sanity, so I didn't feel like not a complete loser, but so I had a little bit of normality, so I was working towards something. So I ended up working for my husband for a little bit, but alongside that I carried on doing my nurse reading, making sure that I could try and keep going with my nurse career, because it's, once you lose touch with your nurse career, you have to retrain, so you have to revalidate every 3 years. So I tried to make sure that I could do that if possible. Then a while after, I had this light bulb moment after I read an article. I was like, oh, okay, perimenopause symptoms. Read all about it, learned a lot about it, actually went on a few courses, and then nurse related courses. Hang on, this is actually me. Went back to the doctors. No, it's not that, not that. So they gave me the pill, which is first line anyway. So I tried the pill, didn't suit me at all. It's sort of a Jekyll and Hyde moment with that. Didn't suit me. The PMS was much worse. Other symptoms had disappeared a little bit, but again, it didn't suit me at all. Went back to the doctor again. I wanted to refer for a menopause specialist. With that menopause specialist, it was obviously a very, very long wait. This was before COVID, so it wasn't too bad of a long wait, but it was a long wait anyway. So yeah, finally they referred me to the menopause specialist, but I also found a private menopause specialist as well, which I got on the waiting list for that as well. Just as the just in case, really. Not that I'd lost faith in the NHS, but it was one of those, I want to be 100% sure. Now I know what it is, I want to get that diagnosis so I'm treated correctly.
Yeah. So how long did it take?
How long did it take?
Yeah.
I've got visions of you suffering there for like 15 years or something ridiculous.
It's actually it was 10 years this year that I noticed my symptoms starting. So from 31, so I'm 41 this year. But yes, it's been a long 10 years and a long battle.
Yeah. Do you think that people are becoming more aware that, because I think, because obviously that was very young to start the menopause, do you think GPs in general are starting to wake up to the potential that it could be an early menopause, or do you think it's still very that they're not very open to that?
I suppose it's learning, absolutely. So it's public awareness. So there's massive public awareness at the moment. There are lots of campaigns from various different places. So ladies themselves are aware, but yeah, GPs generally and nurses generally are actually, they're starting to learn about menopausal symptoms and the different ages, and the perimenopausal symptoms is the time just before you have your full menopause, and those perimenopausal symptoms can last a long time. And it's that time where people can be affected. Some people can be affected quite severely, and I suppose it's just the knowledge of that and trying to treat them. Absolutely.
So what so sort of like the hormones that you're using, so did it take quite a long time to actually find the right balance for you, or are you still having to sort of like play around and monitor everything?
I'm still trying to find my miracle HRT. Some ladies can go on HRT and it's absolutely fantastic. It sorts them out straight away, and that's wonderful. Other ladies need to have a little bit of a mix. They need to find something that's suitable, so they need to go through different ones to find theirs. It can take 3 months to get into your system. So it's the patience and the waiting game for those 3 months to go in, to wait for it to happen. Once those 3 months are over, then going, okay, looking at dosages, looking at your prescriber being able to increase those dosages, and then looking at different forms of HRT. And it's finding something suitable. A lot of ladies, as I said, are absolutely fine, but unfortunately there are a few unlucky few who it can be tricky to find something that suits them.
And so you went along to this to the private menopause specialist, I assume, did you? Is that ultimately where you finished up to get
yes, yeah, I mean,
yeah.
I went to the NHS service first.
Yeah.
Unfortunately, I didn't feel they were very supportive at all. It was quite a negative experience at that time. I did write a complaint letter, unfortunately. But yes, so I went to the private service, who the support there was brilliant. I got my diagnosis. They confirmed that I wasn't going mad. I didn't have dementia, and I wasn't losing my brain, my marbles, my hair, everything. That that I was diagnosed, and that's when I started on the HRT journey. And
how long ago was that? Just out of interest, I'm just trying to get a timeline in my head. That's all.
So it was 2020. It was December 2020 that I started HRT. And I always remember that Christmas was the most, I mean, all my Christmases are lovely with the family, but that Christmas particularly, I found with myself and my own mental health, that was probably one of the best Christmases I've ever had, because of her HRT must have obviously kicked in literally by 4 weeks, that it had improved me that significantly, and how much I'd battled over the past, at that point, over the time that I was fighting it essentially, and just permanent exhaustion of trying to get things clear in my head, and just carry on the hard slog of living when you're feeling like that.
Did you find just getting, sorry Claire, I'm cutting you off. Did you find that was the getting of the diagnosis of perimenopause, was it almost like I imagine it being like just a massive relief, like that first Christmas, knowing that you're not going completely doolally?
Absolutely, yeah. I mean, I sort of knew in my heart that it was. I just needed somebody to confirm and assist with that, absolutely, because everything, there's 48 official symptoms, but I'm sure there's much more. Ladies are all so different that there's lots of different symptoms out there. And the diagnosis relief is huge. I mean, when I'd finished on the phone to the NHS one, I felt so flat. It was my husband's birthday that day, and I remember it. And I'm like, no, I'm not going to let it ruin the day. Carry on, pick yourself up yet again. Then the day I spoke to the private company, and I got the official diagnosis, it was unbelievable. The weight that came off my shoulder, it was like, finally somebody's listening. And it was brilliant.
I think it's like that. It's sort of like, laughing when you're going, oh, I'm thinking I'm getting dementia. I completely understand. I was exactly the same thing. I mean, we've had a chat about it before, and I think sort of like, the problem with the NHS is that in 10 minutes you cannot tell everybody everything that's going on, whereas when you go private, you're getting an hour's consultation, and you can actually tell them everything that's there, and you get that support. And it's like what I had was the chronic anxiety, and what they were saying is, oh, you need to go on anti-anxiety medication. And it was like the last thing that I haven't suddenly got to 48, 49 years of age and suddenly having chronic anxiety. I've never had it before. So I ended up going private as well, which was the best thing that I ever did. But how much better does it feel when you can actually say, this is what I've got? That now there's it doesn't make the symptoms any better, but it's just that, right, now I know where I am.
The relief, absolutely. And once I knew I'd had that diagnosis, literally the day after, I started looking at nursing courses that I could do to help others. So there was a couple of courses I did, and then I started searching for jobs once I'd completed those courses, because I needed and I wanted to get back into nursing, and it was a fine line whether I could actually complete my hours to carry on with nursing. But yeah, that relief was unbelievable, both for mental health, physical, and just general life in itself. Yeah, absolutely.
Angie, meet Rachel. Rachel, Angie.
Hello, nice to meet you.
Hi. Yeah, a little bit late, but never mind. Yeah,
Better late
really
than
good to meet you.
So so you're still having to do a lot of sort of testing of different protocols then for your right balance of hormones.
It's because what I have histamine intolerance as well, alongside the alongside HRT, which at the moment is a rarity, but I think it's more common than we think. So it makes it very tricky to find a HRT that's one that suits me, but also to get my levels for the absorption, because I have a transdermal HRT, so it goes through my skin. So it's trying to keep my histamine level low and then keep my HRT levels a little bit higher, and that I want, so it's the absorbent as well. It can be tricky, but again, the majority of women don't have my my horrific experience of that. It can work for them, but yeah, it is an it's a battle. It's exhausting, but you keep plodding on, and it's finding lifestyle changes as well can really help. Reducing alcohol, caffeine, increasing your exercise, making sure you're looking after yourself, getting enough sleep. All of these things, proper diet can really help with lifestyle, and can really help with symptoms as well. So it's the whole picture, not just HRT as a magic fix. It's also lifestyle, which is a huge part of it as well.
Did you find you got an increase with food intolerances when you were perimenopause or going through the menopause, or did you have food intolerances anyway as well? Or
food intolerance has always been on my radar. I've always had little bits coming here and there. When I was pregnant was the best time I'd felt, because I could eat anything I wanted, and I never had any issues. And I didn't realize at the time, once you do the research, that histamine intolerance, you actually feel better during that time, because of the way that the histamine and hormone that gets rid of the histamine is actually created through the placenta. So when you're pregnant, you feel much better. And I didn't realize that until once I'd had that, spotted it again, the light bulb moment, and then okay, that's why I felt okay during pregnancy. But yeah, absolutely, always had on and off issues with intolerances, but during perimenopausal symptoms, they did start to get much worse. Little things that I used to be able to have, then I suddenly couldn't have at all. So for example, a sip of alcohol would make my face go bright red, beetroot red, and so I knew I couldn't touch it, and various different bits like that. So for example, a chili, having something hot and spicy would itch my eyes, I'd get eczema. The list could go on. I won't list everything, but there are lots, unfortunately.
Because I find a lot of sort of like ladies that I work with, they lactose, they suddenly get a dairy issue, and they're better with goat's milk, goat's cheese, stuff like that, and gluten, wheat. And to be honest, I think a lot of people don't tolerate gluten, even if they don't get massive symptoms. I never get any. I tested fine with it, but I just feel bloated with gluten, so I tend to. Well, I'm keto anyway, so for different health reasons, but I tend to find a lot of ladies do get a lot of intolerances, and makeup, cosmetics change as well.
Absolutely.
Well, there's intolerances and sensitivities, isn't there? And we can kind of fall in between both of those sometimes.
So and one of my nieces went into more anaphylaxis, so never had anaphylaxis before, and so
allergic to what?
Shellfish.
Never
ever
an allergy to shellfish.
To luckily it was a sort of, it was an anaphylaxis, but it wasn't a severe, like, oh my God, that moment. But yeah, it was hospitalization. But yeah, and they realized it was an anaphylaxis. Otherwise, that could have been, yeah, one of our SFG ones, 5 people on it had a severe anaphylaxis shock. So there was, I went, make sure you've got your EpiPens there. I was like, like, oh my God. Yeah.
It is
like,
scary. It is scary.
Yeah, absolutely. It's like, I was thinking, flipping out. I'm like, I've only ever seen one person have an anaphylaxis, and it was the most scariest thing I've ever seen. So
yeah, so yeah, ladies can develop allergies as well as they go through the perimenopause, menopause.
Yeah,
it can just appear, as you said. So it's lots of different changes for the body through hormonal changes. Yeah.
So what's the with you now? Are you being treated privately, or are you with the NHS now? Or
no, my GP has taken over the care. They've come up with their knowledge, which is wonderful. I know they're under extreme stress as the NHS is at the moment, but they've done a grand job, and yeah, they're taking on the care now. I see a different private person now. So anything else, any other like sanity checking with them, obviously I don't look after my own symptoms. I want to obviously check with another specialist. So yeah, speaking to them as well, because there's lots of different things that potentially can come, new things that appear on the market as such to help. But yes, the NHS, are doing a grand job at the moment. Yeah.
Are you doing a lot of sort of like training then? Because you trained with a good friend of mine. So is he still putting you through the regimen on the kettlebells?
Unfortunately, I hurt my ankle. I sprained my ankle quite severely a few months ago. I broke my foot at the same time. That's starting to improve, so I am getting there. But yeah, I'm getting back into it now, and that's my thing for this year, is that I want to lose all my weight again, and get back onto the strength training, definitely. But yes, kettlebells was a lifesaver for me with regards my mental health as well as my physical health. As you know, exercise is wonderful for mental health, so it's one thing that my husband said, oh, come along, come meet Al, we'll see how you go. I was a bit skeptical at first. I thought, I don't end up looking like She-Hulk. I feel like her already. I don't end up looking like her. Obviously didn't at that time. Really enjoyed it from there on, and it's something that's kept me going. I'm so glad that I did it, because it has really helped mental health wise. Yeah.
So what changes have you made nutrition wise? Because obviously you've had to cut a lot of look at things that you get in the intolerances too. Have you found that you've maybe had to change? I find a lot of ladies have to reduce the carbohydrate, the real complex, the refined carbohydrates and the processed foods.
Absolutely. So for myself, alcohol is definitely a no-no. I've reduced my caffeine massively, unfortunately. I do like a coffee, but that's had to reduce now.
That would kill me.
I have one for a treat now and again. But yeah, making sure reduction of complex carbs, so naughty carbs, obviously, just making sure you're having a healthy diet, lots of vegetables. Fruit I can react to, so I'm making sure I have lots of vegetables with regards to trying to get all of my vitamins in, and my nutrition in, making sure I've got enough of each food group. Absolutely. And again, as you said, that sugar doesn't suit me, so I'm always much better without sugar, and unfortunately I do crave it, so it's quite hard. Sometimes I give up and I just have a biscuit, but I try not to now. It's one of those that, no, don't do it, because you feel worse after, and it's one of those.
What symptoms do you get if you do have sort of sugar or a biscuit or something?
So with biscuit wise, if it's got gluten in it, or any of any grains, really, I get quite swollen tongue. And then also sinus issues as well. The sugar aspect of it, I basically go into a sugar coma. So it feels like you're drunk, but you're not. And it can be that. So if you see my kids is a prime example. If they have sugar, they get their eyes dilated, like It's unbelievable. So I think they're the extreme of what's happening with me. So yeah, reduction of sugar. We don't need sugar as such as an extra part in the diet. There's a natural amount in healthy foods that we have anyway.
Yeah. I won't name them because it's a member of my family, even now when they're in the 70s, they have anything sugar or wheat, then they start with hot flushes. They come back, and even in
really
the 70s.
Common. Yeah.
So I'm quite lucky. I've never had one hot flush yet.
I mean, Rachel, you sound like you've gone through the mill, really. And now you're obviously working in that sector and dealing with women that probably have a similar story to yourself or have been through the ringer a little bit. Would you say that your experience is extreme, or is it more common than perhaps like the three of us might think, or the women that aren't quite there yet, who aren't experiencing any symptoms, perhaps, or few symptoms? Is it common, or is it extreme? Or
I think at the time it's extreme, but I think it is more common than we think. Absolutely, especially the mental health side of it. Not everybody gets the mental health symptoms, which is fantastic for them, absolutely wonderful, but I think it is more common than people talk about. Obviously when you get to perimenopause, the average age of menopause is 51, so more ladies towards that age can get mental health issues, and people are, it's you're working, you're getting older, it's too stressful for you, things like that. And well, it shouldn't be. It should be the same as when you were 20 years ago, so it shouldn't make a difference. So it could be it could be reduction or fluctuations of estrogen that are causing these symptoms. But yeah, absolutely, I think it's the more people talk about it, the more people are actually realizing that that symptoms and that people's lives are changing because of their perimenopause or their menopause symptoms. Definitely.
Could you I'm reluctant to ask this, but could you give examples? When we talk about mental health, it's it's like a really broad umbrella, isn't it? It's enormous. So, like I say, I'm reluctant. By all means, just tell me to go away with the question, because I suspect it's going to be a biggie. But could you give us some idea of things that you've heard from women that they experience that would be classed as mental health? I mean, I know some of the stuff's going to be a little bit obvious, like the anxiety side of things, but I suspect there's other things as well, perhaps, that kind of crop up that would fall into that category.
Yeah, absolutely. So yeah, you've got your anxiety. So for me particular, not being able to leave the house, or a lot of ladies find that they can't drive long distance like they used to, or even just going to the shops, they get sweaty palms or hot flush if they're thinking about going. But then being tearful as well over silly things. So you can get the mood swings. If a glass breaks on the floor, you can just burst into tears for no reason. Like, what's going on? It can be something as simple as that, and then something can spark anger. That's why I always say with myself, it's the She-Hulk scenario where you just feel angry for no reason, and then something sparks you off, or a fly comes in the house. You're like, it's ridiculous. It can be, and it's those mental health symptoms. Like obviously the She-Hulk can be PMS related, so it doesn't always have to be mental health related, but it can all be under the classes under the same umbrella, and it can affect everybody in different ways. It can be frustrating, especially if it's not understood and you don't know why it's happening. And I think discussions around it need to happen, so people are aware that it does happen. Absolutely.
It makes you feel less alone as well. You know, I've found from these interviews that I'm listening and thinking, I'm getting a bit like that. Oh, I feel a bit like that. I feel a bit like that. And it makes you just kind of go, you're not the only one, which isn't helpful when you sat on your own. But low mood is very, very common. I mean, some ladies do need to have antidepressants alongside their HRT, and that's absolutely fine if they need that. That's one there. If they do choose to have HRT, then sometimes the estrogen can help quite dramatically with their low moods and their anxiety. In some cases, it doesn't. So again, that's what I said, the antidepressants are there if necessary. So everybody has their individual stories and their individual journeys and needs individual treatment. So it's one of those where you have to look at a person and to try and understand what's going on with them. Yeah, definitely. I've had some pushback. So I've been talking to, I've got my client base tends to be, menopausal women, and I've sort of mentioned this summit and what we've been doing, and I've had a bit of pushback from a couple of them. They're a bit older than me. They're maybe, I don't know, late 50s, early 60s, something like that. So they have this mindset around the HRT about it being dangerous. You know, the whole thing about breast cancer particularly, but wanting to stay away from HRT for that reason. And then, so I don't know how it came up, and it's not, this is why I'm asking you, bioidentical hormones, and one of my clients was very much against that as it being untested, untried, almost she kind of had this, almost like it's like witchcraft, you know. It was just, she was very, very against it. And like I say, I'm not out there advising anybody on anything, because it's not my strong point. One of the reasons why we're doing this. But can you talk a little bit around sort of that journey from HRT being the devil to HRT now being kind of almost pushed? We've even got some research saying it's preventative for future dementia, essentially. Can you kind of enlighten us on where you stand with that? Or
yeah, we as registered nurses follow the BMS, which is the British Menopause Society, and also NICE guidelines, which basically the safety net. So with regards to the bioidentical or body identical, two different things. The one is registered and licensed, the other one isn't. So the stuff that you get off your GP, which is body identical, is tested. It's lots of research done on it, and we know it's regulated. The bioidentical, which you get from other companies, which are not prescribable from NHS based or BMS, British Menopause Society based, they are the ones that we don't know anything about. We don't know where the safety standards are, what works. So bioidentical that you get through through the GP or NHS or other specialists, they are, for example, the majority of body identical, well, all body identical is transdermal estrogen, so patches, gels, and sprays. They are safe. They are safer. Sorry, there's less risk involved. So we can't say anything safe because everybody's so completely different that there's less risk involved for tablets than tablets, for example. The HRT generally, I'll get onto the breast cancer bit in a minute, but HRT generally, you have to outweigh those risks and the benefits for each individual person. So everybody has their completely different history, their past medical history, their family history as well. So you have to weigh those risks and the risks and the benefits. The reason why we don't use, as I said earlier, is the safe word is because, and so everything is completely different. So regarding what you said, the bioidentical, we don't know anything about that at the moment, and people who are given those or using them, that's up to them. That's their choice, absolutely. But what we don't want to use is set standard, and the things that have been done with regards to research is that we want to use the safe, the risk, not risk free, but I can't get my words out here.
It's so hard.
So it's looking at risks and benefits. So we were looking at those things that are more beneficial for you and outweighing them. With regards to breast cancer, it all depends on your family history, your past medical history, and what your prescriber and you talk about. So again, you have the risks and the benefits, and it's looking at those through having all of the information there, and you for making that informed choice to see whether it is for you. Now, there was a report in 2002 that came out that was unfortunately based on a small amount or a small cohort of people. The research was based on a small amount of people who were given HRT. Now, the majority of these ladies were actually already obese. They already had potentially comorbidities, so they already had the potential for diabetes, cardiovascular disease. They already had issues wrong with them, so it wasn't a big enough set standard of what you're looking for as a research base. The new evidence that came alongside that from that research was to say, well, actually, that may not have been full 100% correct. because of this reason, that reason, and so that's why each individual case needs to be looked at properly, rather than just jumping, yeah, it is risk-free, or yeah, you do have a little bit of risk. So again, it's discussing it with a prescriber.
Yeah, and like you say, if your symptoms are so bad that your quality of life is not great for over 10 years, then perhaps, you know, you might take a little bit more risk than perhaps you would do if your symptoms were just minor, I suppose.
Did you find as well, Kelly, the some of the pushback that I had was, well, it's a natural part of aging, the menopause. Why are you trying to, you know, why are you interfering with what nature naturally does? And I read the book Estrogen Matters, so I actually made an informed decision anyway on what I wanted to do. So and it was like, well, to me, I want to be able to function. Two, I need to be able to work. I was, you know, my joints were hurt, everything was hurting, and to be honest, I was like, well, I would rather, to me, even if there was any risk, which personally to me, with my history, there really is very little. And to me, the actually using the medication, the hormones, was, I mean, it was life-changing for me, definitely, you know. So, but I think that was the main thing that I found. Well, it's a natural part of aging. Why are you interfering with it?
Which there's part of me kind of, sorry, Rachel, part of me does kind of not agree with that per se, but part of me is sympathetic to that argument, the sense that it is a natural part of being female and getting older. That said, do we need to suffer if
that's what I'm thinking.
That suffering is there? I'd be very, very interested. It'd be fantastic if we could find somebody who had historical knowledge around menopause as to how what happened, you know, when we lived in a cave or swung from a tree, and what happened in that period between now where we've got the ability, what was going on 200, 300, 400 years ago, you know, what
We didn't live long enough.
Yeah. Good point. We were dying.
That's it. We didn't live long enough. So yeah, as time has gone past, sort of we're getting to your pre-menopause when you're having periods, then your perimenopause when your symptoms are starting, then your menopause and your post-menopause. And 300-400 years ago, not many ladies probably survived that long to experience these symptoms, but also change of lifestyle as well. So we never used to sit in front of screens, so symptoms were different, and it's ways of different managing, and then the knowledge of knowing what things are. I mean, you said earlier with regards to again the safety net and you know the risks and the benefits. There is evidence to say that that you know HRT is really, really helpful for cardiovascular. It can prevent cardiovascular. It can prevent diabetes. It can prevent some types of cancers, and it can really help with osteoporosis. There is ongoing research regarding the dementia and element of it, but that's not full as yet. But absolutely, it's that individual risk and benefits again to see if it is suitable for the person. And if a lady chooses not to have HRT because they haven't got many symptoms, that's absolutely fine. Good on them for not having symptoms. I'm very jealous. But again, it depends on that person. If you struggle that much, then as you said, you don't have to struggle. There are things out there if you wanted to. And it's making sure you're getting the correct HRT that's suitable for you. The various different regimes where you are, depending on your periods, whether you have periods, whether you don't. If you have a uterus, if you don't have a uterus, if you have a womb. So there's lots of different types of HRT that you can have.
I was sold on the anti-aging.
It's something that
I'm doing that. But a good friend of mine, his wife, her cycle just stopped, and that was it. She never had anything.
Wow.
I'm like, wow. How lucky.
We're all sat here going, oh,
that's it.
And
I said to her, I'm like, I really hate you. Like, you know.
I find that when I speak to people like that, when you have a deeper conversation, sometimes there are symptoms. They just weren't aware that the symptoms were part of perimenopause. But we all hope for that, don't we? So we'll see.
Definitely didn't happen for me. And Rachel's got it all awful compared to me. Mine's really compared to you, Rachel. I'm like, it's a walk in the park, really. But I mean, we had a couple of long chats, didn't we, about all the symptoms and stuff like that. It's like, it's brutal.
One thing that I wanted to bring up, just thinking of what you were saying there about the general benefits for taking the hormone therapy, and we're becoming more aware of those benefits, and lots more research needed and being done, which is great. And one question that comes up from my clients, and I coach women through doing what they need to be doing to keep themselves healthy through peri to postmenopause, and helping them navigate that sort of confusion around it. One question that comes up quite a lot that I have to answer very individually for each of them, but I wondered if you could give some insight onto this idea of hormone therapy as a preventative, because you mentioned there it'd be great if we didn't have, if you don't get the symptoms, great, you don't have to take the hormone therapy. But also there are some women that I speak to that are worried that if they don't take the hormone therapy, even though they've got no current problems, they're thinking of bones and heart and brain, and they're thinking, do I do this now because the research is saying it's better in my perimenopausal years perhaps than postmenopausal, although that research is also ongoing as well, I appreciate. But is it better for some women perhaps to use it as that preventative? What would you say to those ladies? And that's a big question, I know. So sorry.
It is, yeah. It's all individually based. I mean, if somebody's getting a little bit of symptoms and they want to have that, want to have HRT to get rid of those symptoms, that's absolutely fine. But again, it isn't for everybody. And if somebody wants to have it as a preventative, you have to look at the effects. If you've got the risks, you're outweighing the risks and the benefits. So what's going to benefit you the most? If you depending on the age as well, as I said, the average age is 51. So if you're already 55 and you're absolutely fine, you've gone through it. If you're fit as a fiddle, if your lifestyle's fantastic, your diet's fantastic, if you're having supplements, if you're doing strength training, if your family genetics is fine, there's no individual way of saying, oh yeah, you'd be better doing it, or no, you better not. There's lots of different aspects, so it's not an easy answer to give as such. So it's so individualized.
Yeah, I'm so pleased you've said that. It's very much congruent with what I tell them, and I think that will be a question from viewers as well for themselves. It seems to be coming up more and more. So thank you for that.
I think it's individualized how much people are prepared to put up with as well. So for some people, having 1 or 2 hot flushes a week is the end of the world, and then for other people, imagine that tenfold, and they are quite happy to just puddle along and get on with life, and it almost doesn't register as much. So I suppose there's that individualism as well. What people are prepared to sort of put up with.
And also then the awareness of that individual, because the people that are in my world probably have a little bit more awareness of what's going on, and some of the research and things that I share. And there's certainly some research showing things like hot flushes, like you mentioned, can be linked to cognitive issues as well. It's not just a temperature problem. So they're probably linking that up in their brain and thinking, maybe I should do this to help myself out now before things get even worse. But yeah, I always push them to individuality is the thing. There's no blanket approach with the hormone therapy. It can't be one size fits all.
No, it's a lifestyle as well. For different cultures have different experiences with menopause. Eastern cultures, for example, their menopause symptoms are minimal, and because of their lifestyle, their food that they eat can make some massive impact, make a massive difference as well. So I think that there's an article on the BBC, I'm not sure on the evidence for this, but it suggested that an old lady who started to get dementia changed her lifestyle, her diet, improved her diet, tons of vitamin-rich foods, broccoli, spinach, started to increase and improve her diet, and then her dementia's reduced. I don't know about the evidence with that, but diet does play a massive part in health generally, and again that comes hand in hand with exercise as well. So it is all lifestyle related as well.
I suppose when you look at the gut, sorry Kelly, the gut health, brain health, that there's such a close correlation that, and I think when we look at that, our gut microbiome now is going to be so complex because of what we eat. I mean, we don't eat as nature intended anymore, do we? Really, everything's so heavily processed
and available all year round, and whenever you want it, how much of it, the strobilome bacteria being involved in that, GABA, and
I mean, are we saying essentially though that individuals and either extreme aside, that the healthier you are, the potentially the less menopausal symptoms you're going to experience potentially?
Depends on the person, against individualized. I mean, I wouldn't say I was unhealthy at the time when my symptoms started. It's more genetics that I experienced early perimenopausal symptoms. So I used to do used to go to the gym all the time. I used to do yoga, so exercise isn't a new thing to me. It wasn't obese. I was looking after my mental health, running around with the kids, healthy food. So it depends really on the person of what's going on. And it's again, it's all individualized. So you can be the healthiest person in the world, such as Claire, can't get any more healthier than yourself, and then you get symptoms. So it's one of those.
So did you find sort of like, so if you're sort of perimenopause and you start on the HRT, do you find sometimes that you may, after a period of time, as it getting closer to menopause, have to adjust the medication, the HRT, because they start to get symptoms, varying symptoms? Because I'm getting a few symptoms back again, but in all fairness, I do have rather a lot of personal stress going on at the moment. So I have no idea if it's that or the hormones or...
exactly. It could be either, absolutely. But yes, as you go through your menopause journey, HRT can or does sometimes need to be changed depending. Some people notice that they need a reduction in their treatment, other people need an increase, and it can depend on age, it can depend on other factors as well. So again, it's all individualized. So average age is 51. Majority of ladies, according to the guidelines, say 5 years is maximum. However, you can be on that longer if you're looking at the risks and the benefits. Again, it's so individualized, and it depends on what's going on for that person.
It just goes to show, doesn't it, that if you're going to go down that route of taking hormone therapy, it really needs that one-to-one conversation with a specialist like yourself to go through what's like past, present, future, and really look at all of those things that have been going on. Because when things start to change, symptoms change, don't they, as you go through it. And instead of trying to self-medicate with some things, you can get anything on the internet, you can buy anything, but it's worrying, isn't it? It really needs that real medical support if you're going to go down that route. Really need to have those individual conversations all the way through.
Definitely. And continuous, I mean, annual checks basically is ideal, but it's not only the annual checks just for HRT treatment, it's just general annual checks as well, checking, for example, thyroid, cholesterol, lots of different things that can all come into under the same umbrella. So for example, somebody who's anemic may get hot flushes. It might not be perimenopausal symptoms, it might be that they're anemic. So lots of different things that can overlap, lots of symptoms that can overlap. So it's making sure that they're getting those reviews done to check that everything is supported. Yeah.
Yeah, absolutely.
So any more questions? I could talk for hours about menopause. Perimenopause.
I was
go on, go.
I was thinking delving back into the hormone therapy and the cancer risk conversation. Something that came into my mind was the thought that not all cancers are hormonally driven, and I don't think everyone's aware of that. We tend to think, oh, cancer, we kind of lump that as we kind of put that all in the same bracket, all in that same conversation, and it's another example of I guess I'm not the cancer specialist. It's another example of individuality and risk factors, and I'm just thinking of people I've spoken to and conversations I've had where people are comparing themselves, saying, I've had breast cancer, my friends had thyroid cancer, and we've got different treatment with navigating menopause. I think I should be on the same thing. I think people sort of forget that there are different types of cancers and risks, and I wondered if you could shed some extra insight.
I think you've said it all, really. Again, it's all individualized. I mean, some cancers, particularly breast cancers, ovarian, endometrial, they can be hormonal driven, absolutely. And that's where you need that caution for HRT. It's talking to specialists, needing to speak to your cancer specialist or your menopause specialist at the time, whether a thing is suitable for you. I mean, a lot of ladies are unable to have HRT because of that risk, because they've had previous cancers that are hormonal related. But again, there's lots of new research being done relating to all of that. Women's health particularly is extremely difficult because of the fluctuations of hormones. Majority of medications are tested on men, not on women. So we don't know where we are with the hormones. It can be really tricky. So it's all a sort of a new thing that's coming up that people are actually looking into it. And there's loads of research being done regarding it. It will take time, as everything does, but it's talking to specialists, talking to a combination of your cancer specialist or menopause specialist or your gynecology specialist, lots of different avenues, but it all depends on the individualized circumstance, definitely.
Yeah, thanks for that. Great.
I think the only question I wanted to ask if we're finishing off is just the one that I'm asking everybody is there anything that you would have liked to have talked about that we've not kind of covered? Anything you're more than welcome to say, no, if I've covered everything, I don't want to put you on the spot. It could be a bit like, just ask me a question.
I think it was more the exercise related, strength exercising and cardio, different types of exercise. I think you lot all know more than me with regards the pushing yourself with the cardiovascular. Strength training is just as important. So pushing yourself, doing jogging every day, really getting to that stage where you're exhausting yourself can actually be less beneficial for you than expectations that you think it's doing. I mean, with regarding especially what they call the middle-aged spread with fat around the middle of your waist, it can be very, very frustrating, but that is there because of the lack of fluctuations of estrogen, and the fat around your waist is there because you have estrogen receptors all over your body, and those estrogen receptors and that estrogen is stuck in that fat because your body is not making enough fat anymore. So your fat is going, right, well, I'm going to keep hold of this then. Hence why your body has this lovely ring of fat around your waist, which all women absolutely hate. And it's trying different types of exercises to get rid of that.
Yeah. Well, actually, then, I mean, because we've not kind of touched on running with this one, really. Not most, some of the other sessions that we've had, people have been more focused on the running. So that's really interesting, because I think certainly from my perspective, working with menopausal female runners who will push themselves beyond what even I would consider, you know, healthy, to say the least. Can you expand a little bit on that kind of, feel like what you've just said is really, really important, and probably something that most women don't know. But it's so, if even my brain kind of was going, no, just need to run more to get rid of that. No, I've had a biscuit, I just need to go out and run for 3 miles and I'll be fine. And we know it doesn't work, but we're still it's so ingrained.
They don't believe me when I say that.
Yeah, I don't believe me when I say it.
And wait till I throw something
I
into the mix as well.
Say if you've always ran, and that's absolutely fine. But so for me, I started running, and I was like, this is just exhausting me. Doing jogs a little bit now and again is absolutely fine, just to see how far I with my kettlebell swings, how far I can actually run for fitness, to see how much it's improved. I just do a bit of an experiment with that. But for running to push myself, I can't do that anymore, for my own physical health. But strength exercise or cardio, again, is down to that personal individually. If you've always been a runner and you're a marathon runner, that's absolutely fine. But pushing yourself, and then Claire and me have spoken about this before, looking at the different types of hormones that are released when you're pushing yourself. You obviously, when you do exercise, you get the happy hormones. That's really, really good for mental health. But if you overdo it, you can get other bits and bobs coming, which I'm sure you'll talk about, that can affect you and have a negative impact on you. So strength training is really good particularly for the osteoporosis side of it. So you've got your muscle training, your muscle strengthening, and then also going into your bones as well, as long as you've got the good diet to go alongside that. So for example, if you've got a really poor diet, you haven't got enough calcium or vitamin D or E in your system, then that is not going to go into your bones. So you need to make sure you've got, again, that full lifestyle to make sure you've got enough of everything to help with the osteoporosis side of it. I can see Claire itching, so carry on, Claire.
No, I'm just thinking, because it was like, what I get is, because obviously I'm not a runner, but I get a lot of ladies, especially this time of the year. So where I am, I see people sort of like started running the new year, new me sort of brigade. And they're of a certain age, and there's a lady that I see, she's always run, but she's getting bigger and bigger and bigger. And the issue is, one, obviously she's probably of a certain age. I don't like to assume. I've done that before and assumed, and I'm like, no, they're not of that age. But I would imagine she's probably perimenopausal. She's getting larger, so her cortisol levels are probably high anyway. And my thing is, when people go, I'm in my fat burn zone, really? And how do you know that? And most people aren't accessing the fat stores anyway. So because, if you're driving your insulin and blood glucose and running off glucose all the time, are you actually using fat as your energy store or not? There's always that, especially if women are using running as their main weight loss tool. Yeah, I'm not saying about women that already run, if they already run and that's what they do, but even then they probably have to make adjustments to it.
I was going to say, I think even, that there is that there are identities of a runner. You might have somebody who's just started, and that they're kind of like, that's a different kettle of fish altogether. But for women that have been running for however long, who identify as a runner, in other words, they've been bitten by the bug, and they'd rather chew off their own foot and do strength exercise or stop running. So it is a harder sell for them to explain to them why they need to alter things or add things or change things up a little bit. It's not a case, we're not saying stop running, but we are saying, what you're doing isn't giving you what you think it is anymore, essentially. And I think ultimately, the result of this, given how I'm conscious of Rachel's time, apart from anything else, is we probably could do with doing one of these with probably you, Claire, or whoever, around that specific, the belly fat, the cortisol levels, the shifting stuff, all of that, I think would be a really good one to do, because I think people would find that really fascinating.
It's a very common topic in my world, very common.
Right, well, there we go, then we've got another topic.
Sally will be a good one for that one.
Great, well, we'll right, okay, so Rachel, do you want to name your clinic that you work for? I mean, you're more than welcome to give it a plug. Hopefully this is going to be reaching out to women who are going to need your help and services. So by all means, tell us where we can find you.
I won't at the moment, because where I work, it's more for business related rather than individuals, so it wouldn't benefit people unless they work for a bigger company. But yeah, it's one of those. Unfortunately, it won't help any people here unless they work in a big company.
Yeah.
Okay.